My pain has died down significantly since I've had it removed.
But the trauma is still with you?
Oh yeah, I think the trauma will always be with me. And I think
Sarah's trauma started 7 years ago when she had a mesh implant fitted to treat incontinence caused by childbirth. It was then her life changed.
As soon as I woke up after the surgery, there was an issue, and I knew there was an issue. Felt like someone had got a knife edge and was cutting it across my urethra. And I had pain down my leg and pain in my pelvis.
Thousands of other cases like this prompted the NHS to stop using mesh procedures last year. But now the National Institute for Health and Care Excellence has recommended it can continue, since it says there's only limited evidence on the long-term harms. New guidance suggests women should consider other treatments first, like physiotherapy, medication and weight management before opting for mesh surgery. They should be given information about all its risks, and a national database will be introduced to detail all complications. But of course, these are just recommendations and not compulsory.
I think it's absolutely appalling. Most of the clinical trials only focus on outcome. So what I mean by that is they only look at if the operation has worked. So for a lot of women in our group, it has worked. It's fixed their incontinence and it's fixed their prolapse. But what the studies aren't logging is, are you in new hideous amounts of pain? Have you lost your sex life?
More than 7,000 women who've had the procedure have experienced chronic pain. Their complaints led to an ongoing government review into how the NHS dealt with problems caused by vaginal mesh. One consultant, who doesn't use the surgery anymore, says there are some cases where it can work.
You have no alternative. You've tried everything else. It hasn't worked. And you want to maintain and restore some quality of life. So in that sort of situation, yes, you may have to use mesh. But you need to do it really under very, very strict circumstances.
Sarah says she is living evidence that mesh does cause long-term harm. She doesn't want anyone to go through what she has and wants NICE to think again. Emily Morgan, ITV News in Bedford.